Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over patella tracking disorder. What is it and what are some things you can do to help manage it effectively? Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos. So, with patella tracking disorder, or your patella, the more understandable term is probably your kneecap. When your kneecap, or when your knee bends or straightens, your patella, your kneecap, has to move ever so slightly within this groove created by your femur or your thigh bone. And so what can happen is either the patella can have poor stability, so it won't stay within that groove as you move, or you could also have some poor alignment and poor movements at your hip joint, which causes the underlying femur to move and displace that patella in the wrong position. So when that happens, it feels like a lot of stiffness, pain, and discomfort when you're trying to get the best range of motion of bending or straightening the knee. So let's go over some different things that you can do to help manage this effectively, decrease any symptoms, and hopefully maximize the range of motion of your knee. So the first thing is just doing some patella mobilizations or kneecap mobilizations. So the best way to do this is to be seated or like laying down on a couch or on a bed and just having your leg out in front of you. You want it completely relaxed. If any of your muscles are active, it's going to make it really hard to move that kneecap. And you can use, just the one hand. You can use two hands. I have some other videos that really go into patella mobilizations, but just for a general overview, I usually like to start just side to side so the person gets the idea. They can see that kneecap moving side to side, see that you have some control and you can move it with your hands. And then the main thing we want to work on is these mobilizations up toward your head and down toward your feet. Whenever you straighten or extend your knee, that's going to move the patella slightly upward. Whenever you bend or flex your knee, that's going to move the kneecap slightly downward. So just trying to really stay relaxed and just doing some oscillations up toward your head and trying some down toward your feet as well. Making sure there's good mobility there, there's not a lot of tension or scar tissue. The next thing is going to come down to is a lot of different exercises for strength. And there's two particular areas we're going to focus on. So one of them is your quadricep muscles of your thigh. And those big muscles are going to provide stability of the kneecap. And it's going to help that kneecap track and stay within that groove of your femur or thigh bone. So if you have a lot of weakness in your quadriceps, your kneecap might deviate out to the side, it might move inward too much, just not be in the right position. So a lot of muscles to build as much strength, in the quadriceps in your thigh is going to build that stability and good tracking of the kneecap. So things like quad sets, so laying down or seated and just contracting that muscle, trying to extend the knee and hold it, contract it, and relax off and on. You can also do seated knee extension, straightening the knee up and down just like this. You can do body weight squats, you can do step-ups, anything that's going to activate and strengthen those quadricep muscles. The next area is we want to look at your hips and pelvis. So again, if your hips and pelvis have poor alignment, maybe you have this Trendelenburg when you're walking where your hip drops to the one side. Maybe you just have general weakness when you're standing up or doing different movements. And that can really cause that, again, that poor tracking. As the position of the groove and your thigh bone changes, then the kneecap's going to move out of position as well. So strengthening your hip muscles and doing it with good alignment. So things just like standing on one leg and trying to keep good, even and level pelvis and not letting it fall down. And just trying to maintain that for 10-15 seconds or so. And then switching sides. You can do things such as some isometric presses into a table or into the wall. So holding that leg up and pushing the leg out to the side like this. Pushing it and holding it. And then I always like to do, You can call them like some single leg squats or some step downs if you have a step. And just practice bending down ever so slightly and then coming back up. And just making sure that knee doesn't cave in as you come down, the hips don't drop. You just want to keep a good alignment, keep the pelvis nice and level, keep the knee tracking underneath the foot and not caving inward. And as you get comfortable doing it on an even surface, you can go up on a small step and try it from there as well. So those are the main ways. Is really you want to build that strength, build that stability so that the kneecap itself has good stability and positioning, but also the musculature and the alignment with your different movements is good as well. So thank you very much for watching. I hope you found this insightful and helpful. Be sure to leave your questions below. Be sure to hit that notifications button. Be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. Thank you.